2015, about middle of the school year. I was actually at a basketball practice, and I went up for a layup, and when I came down, I felt this sharp pain in my back. I could put it off and play through it for about a year, and that's exactly what I did. But then junior year came around, and the pain was just so immense, I couldn't do it anymore. So what ended up happening was we went to the doctor's office, got an X-ray, didn't show anything, so I was a little disappointed. And then got an MRI, and it showed that I fractured a vertebrae in my back. The doctor said there was two main reasons for this. One, I had weak back muscles. Two, my tight hamstrings. Well, these are both relatively minor injuries, so what could have been done to prevent this? Physical therapy needs to be increased in a patient's life. Physical therapy would have prevented and diagnosed my tight hamstrings and my weak back muscles, thus preventing the fractured back. But what do I mean when I say increased physical therapy? What does that mean? Does that mean 2 times a week, 3 times a week, 3 times a month? Maybe it's just a routine checkup similar to like a dentist office. Well, one thing is for certain. No matter how much you increase physical therapy by, there's going to be a few things that results. First, you're going to save money. And this might seem contrary to what you might think because physical therapy is expensive. Adding more physical therapy is going to mean more money. But one of my options for my fractured back was to have surgery. And surgery in the US has an average cost of $45,000, roughly. Okay, and physical therapy varies a little bit more. For the initial visit of physical therapy, it ranges from about $75 to $250. And then the visits after that, the follow-up visits, will be anywhere ranging from $90 to $110. Okay? So now taking into account all of insurance, the initial visit, the amount of follow-up visits, which is usually around 13, the average cost for physical therapy is roughly $1,100.05. Now, despite that 5 cents, compared to surgery, $45,000, $1,100, that's drastically a difference. Second point that will always result with increased physical therapy: it will raise your life expectancy. Now, this kind of goes pair in pair with cheaper physical therapy, because this is gonna reduce the chances of you having to have the surgery. Surgery decreases life expectancy. Now, believe it or not, your body wasn't made to be cut open, have things rearranged, and then put back together. Your body wasn't designed for that. That's not how God made us. So, by reducing surgery, therefore, you are increasing your life expectancy. The last thing that will always result is you'll be less likely to catch diseases. Yeah, diseases. Things such as diabetes, coronary heart disease, such as heart stroke, and even cancer sometimes. But if a person does get injured or does get diagnosed with one of these things, they'll be directed to physical therapy. But what actually happens? How do they fix that? Well, they'll take the muscle group, or the muscle, or the bone, or the tendon, or whatever it is. They'll stretch it, they'll heal it, and ultimately they'll relax it. And that's how physical therapy differs from surgery. It's low impact, and it's a slower process, but you're giving up that impact for your life expectancy. Now imagine over a long period of time, say a year, just taking one part of your body at a time and going to physical therapy, let's just say 2 times a month. There's 12 months in a year, and then you take 2 times, that's 24 periods over the course of the year. So then you just take, say, my weak back muscles. For 1 week, you'll focus on your back. For the next week, you'll focus on your hamstrings. You'll take all these different parts of your body and focus just small portions. But imagine that. All these parts of your body being relaxed and strengthened and stretched out. All of the minor little injuries, such as weak back muscles or tight hamstrings, will be reduced to a minimum. This will also reduce your chances of major injuries, because usually these small injuries, such as in my case, lead to bigger injuries, such in my case. So all in all, if you increase life expectancy, you're going to save money, you're going to raise your life expectancy, and you're going to reduce your minor injuries, which also reduce your major injuries. Thank you and have a good day.